On this episode, we'll talk about dealing with menstrual cramps. We'll also talk about when is it okay to drink from a straw and can you deduct your surgery from U.S. taxes. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 131 of the AskDrA show. Thanks so much for sending me your questions. You are always welcome to do so. You can do so three ways, well actually four ways. You can use the email questions at Endobariatric.com. You can use my Snapchat account. You can use the hashtag AskDrA, and you can use my personal Instagram account. Boy, am I having fun with that one. You can always follow me on Instagram and stop by and say hello. Let's get into the show.
What can I take for menstrual cramping pain?
All right, so the question arises because when you deal with menstrual cramps, we've said so before, you want to avoid taking NSAIDs, and most patients, female patients of course, would take ibuprofen for menstrual cramps. Advil, ibuprofen, Motrin, so on and so forth. Dealing with menstrual cramps once a month, of course, and 1 or 2 days will not cause any major issue with your sleeve. You are okay to take them. But when you take anti-inflammatories that fall into the NSAID category that we've talked about before, you may cause harm to that sleeve or practically any stomach. It doesn't have to be a sleeve itself. Regular patients with a sleeve, without a sleeve, with a bypass, with whatever you mentioned, will have issues because these medications cause thinning of the inner layer of the stomach, cause bleeding of the upper GI tract, so on and so forth. But once a month, let's say you have one really bad day a month when the cramps really hit you and you want to take the Advil, is it okay? Believe me, you won't have an issue. All right, so I hope this answers the question.
When can we start drinking with straws?
Okay, so I know we've talked here and there about the straw situation, and straws, the reason we try to avoid the straws, and it's the regular straws by the way, not the little small ones that come in like the high C juices or little boxes of juices. Those are very small, you can use those. There's practically no air that you are intaking. But when you use a regular straw, when you suck on the straw or on the fluid, you are intaking a column of air prior to the liquid. So that column of air you are ingesting, you're swallowing this air and goes into your sleeve. The first 2-3 months may be a bit uncomfortable. It doesn't mean you are at risk of hurting your sleeve. It will not happen, but I would recommend 2-3 months to avoid these straws, and afterwards just to avoid this uncomfortable sensation.
Can I deduct my surgery on my US taxes?
Yes, you can, at least with our practice. Even though you come down to Mexico and have your surgery, we do give out a receipt. So it's actually we do have a regular IRS receipt that you can use to deduct, use it for your taxes back in the States. Or if you need to, I'm thinking about the word, itemized bill. Some people want an itemized bill to use to claim for the insurance company. We can give you both. Actually, the IRS one, we give it out to everyone because of course you came and paid, and you can use that to write off your taxes back home. So that is totally valid. We have checked with US accountants and you can do so. All right, so there you have it. That's it for episode 131 of the AskDrA show. Thanks so much for being here. And just to add a little extra information on the tax form, just FYI, any medical expense that exceeds $3,000, you can always write it off. So there you have it. All right, so I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless. I'll see you online.